Hello, thank you for watching. Today I will be talking about suicide awareness and prevention. Who is most at risk? 5 steps in helping someone in emotional pain. What needs to be done? And protective factors. Suicide awareness and prevention. 83 people died because of suicide. Suicide is also the second leading cause of death for ages 10 to 34. The highest rate occurs with persons 75 and older. Suicide rates have increased 36% from 2000 to 2021. And the top ways of committing suicide is by firearm, suffocation, and then poisoning. Interesting facts are that 54% of suicides involve a person with no mental health problem whatsoever. Men make up approximately 75% of suicide deaths, and research suggests it is due to men choosing a more lethal means than women when executing a suicide attempt, such as firearm. Elderly make up a high number of statistics due to depression and loss of dependence. Risk factors can include a combination of individual, relationship, community, and societal factors. Individual risks include previous suicide attempts, history of depression, mental illness history, serious illness/chronic pain, criminal or legal problems, job loss, financial problems, impulsive tendencies, substance abuse, current or prior history of adverse childhood experiences, or violence, victimization. Factors that tend to go from suicide include bullying, loss of relationships, family history of suicide, social isolation, and violent relationships. Some community and society factors that can have an impact on someone committing suicide is easy access to lethal means of suicide, such as leaving medications out or firearms that are not locked up in a cabinet. Lack of access to healthcare, stigma associated with help seeking and mental illness, unhealthy media portrayals of suicide, and discrimination. Now let's take a look at some protective factors. Knowing the signs of someone that's going to commit suicide, such as detachment/isolation, giving away close personal possessions, talking about wanting to die, talking about feeling trapped, feeling unbearable emotional and physical pain, putting affairs in order, like making a will, feelings of empty and hopelessness, taking risks that can lead to death, severe mood swings, using alcohol and other drugs, and changing eating or sleeping habits. Being able to see these signs of suicide can save a person's life. If you recognize any of these signs, there are 5 steps to helping someone in emotional pain. The first step, although it might seem uncomfortable, is to ask, are you thinking about killing yourself? Number 2 is keep them safe, reducing access to lethal items that a suicidal individual may want to use in a suicide attempt. Be there. Listen to the individual and how they are feeling and thinking. Let them know that you are there. 4, help them connect to resources that are available in their community and their time of crisis. And last but not least, stay connected. Staying in touch, not letting the individual isolate or be alone with their suicidal thoughts. So that leaves us with the question, what needs to be done? Improved interaction with the elderly population to prevent loneliness is key in getting rid of the elderly suicidal thoughts. Not make lethal items so accessible in the home. Lock up your weapons, lock up medications, etc. There should be more awareness in public schools and educating them better ways to cope with emotional distress. Better parent interaction with their children to know what they are thinking and feeling is needed as well. If you or someone you know is struggling with suicidal thoughts, there are hotlines. The national hotline for suicide and emotional distress is 988, or you can send a text to 741-741 with the message TALK, and someone will get to you. If you are a veteran, there is also a national hotline text that can be reached by texting 838-255 or calling 1-800-799-4889. Emergency rooms are also equipped to deal with suicidal individuals and you can refer them to needed help. If this is an emergency, always call 911.